Dr. Jaffe, when someone has a hard draw for the LRA test, for instance, they pass out at the sight of a needle or are very nervous, what are some recommendations to give practitioners on how to make the draw easier?
Very important question, because the person who's having the blood drawn does not need to do anything except be present. Now, my suggestion is, before the blood is drawn, ask the person if they are concerned. If they have had any adversity in the past, you know, like getting lightheaded or passing out, you can draw the blood with them lying down, if that's available. I think that can be an option. Beyond that, I used to instruct the phlebotomists as following. Ask the person to look away and see themselves in the situation that will speed their healing, because I'm here to simply take a small specimen, and if you watch, the chances are you're going to have some adrenaline, or maybe even get a little anxious. Sometimes people do. Notice what I said. Sometimes, I'm not telling them they will, but I'm not making them wrong if they do. And I think that's simple instruction: to look away, see yourself in the situation that speeds your healing, and allow the phlebotomist to take the specimen. For whatever reason, many people feel they need to watch because, you know, the blood might spill out of the tube. I don't know why they want to watch, but it's a human nature to do so. It's not necessary. And my suggestion is the quote simple instruction to use this for a moment of mindfulness to speed your healing. See yourself in the situation that can help with the healing while the phlebotomist does their job. Anything else about that question? Because there are several aspects to a difficult draw, but one is with regard to the person offering the specimen. And as you know, we want an ex vivo specimen. We want a specimen just as they are. And if they're anxious in life, we accept them as they are. But we don't need more anxiousness than is necessary or usual for that person. And sometimes just drawing blood, or seeing a white coat, or seeing a person rush in because they're busy to do something like take the specimen without really making contact with the person. And so I do think it's important to establish a brief rapport, to let them know that if they have anything in their history about drawing blood that they want us to know, that should be elicited, solicited, asked for, and then give them the instruction to not be a backseat driver, in a sense, in regard to taking the LRA test sample.